Hi everyone. Here 3-year-old child developed severe hypoglycemia after prolonged fasting. Okay. And on examination there is hepatomegaly and laboratory finding was increased glycogen level in the liver, elevated lactate level and hyperuricemia along with hypertriglyceridemia. Which enzyme deficiency is the most likely cause? Here is it is a glycogen storage disease. So if any patient presenting to you with combination of severe hypoglycemia, prolonged also there is hepatomegaly and elevated lactate level, hyperuricemia, hypertriglyceridemia, it is suggestive of one jerky disease. Okay, it is a one jerky disease. Which enzyme is deficient in this disease? That is glucose 6 phosphatase, because glucose 6 phosphatase is required for conversion of glucose 6 phosphate to glucose. So due to deficiency of this glucose 6 phosphatase, glucose cannot be released into the bloodstream. For gluconeogenesis and glycogenolysis it will require. So what are the key features? Key features, that is severe hypoglycemia and hepatomegaly, lactate. What are the causes of these things? Why hepatomegaly? Hepatomegaly just because there is excess of glycogen. Excess G6PD is converted back into the glycogen, so causing excess glycogen accumulation in the liver. So what are the causes of lactic acidosis? Lactic acidosis due to accumulation of excess glucose 6 phosphate, it convert into the pyruvate. Okay, pyruvate level. Okay, so excess pyruvate lead to increased lactate production. Okay, so it will lead to lactic acidosis. Why hyperuricemia? For renal excretion, lactate and uric acid both will compete, so there is retention of uric acid. So elevated lactate level compete with uric acid for renal excretion, so there is a reduced uric acid clearance, so increase nucleotide turnover. Okay, and there is also hypertriglyceridemia. Excess pyruvate convert into the acetyl-CoA driving fatty acid and increase triglyceride synthesis, so it is a de novo lipogenesis. And option B is branching enzyme. So branching enzyme deficiency lead to the Anderson disease. Okay, debranching enzyme deficiency leads to the Cory's disease. Okay, and liver glycogen phosphorylase deficiency lead to the Hirsch disease. Okay, so it is very important for your NEET PC.